262016, this Syrian hamster, 3 months old, came in with a complaint of a swelling in the stomach area and not eating for around 1 to 2 weeks. That is the complaint from the owner. And this is a 3-month-old female Syrian hamster. Now I'm taking it out to weigh and to examine it. Now you can see this hamster is definitely swollen in the abdomen. It's a very big swelling. I'll weigh the hamster. Okay, the weigh hamster. Now we weigh the hamster because it's important to weigh the hamster so that you don't know the weight every time it comes in. So it's 94 grams. It's 94 grams, you can see. Yeah? So after weighing, we have to wear gloves because just in case it bites. Now you can see that there is a urinary incontinence because there is a big wet area here, and also the hamster has a very strong smell, urine smell. Just like pass out some urine on the paper, which you can see is a clear urine. Okay, now that is the history. Now physical examination of course includes abdominal palpation because the owner complained that the hamster had a lump in the abdomen inside the stomach, and it's true. I can feel it. Use a forefinger on both sides, and I can feel in the abdomen a very hard lump. It's a very hard, solid lump, very hard. It could be a tumor, abdominal tumor, splenic tumor, or it could be just a swollen bladder, which of course will be unlikely because of the hardness of this lump. This lump is as hard as firm as what I call it, a small fish ball about 4 centimeter times 4 centimeter. But of course it could be a swollen bladder. It could be a swollen bladder as well. So the thing is, we have to do an X-ray. So now we have the X-ray here. Now the X-ray shows, this X-ray is the original X-ray. It shows definitely there is a big egg-sized lump about 4 centimeter by 3 centimeter. Now this is the stomach with the gas. Now I mean this lump, of course it could be splenic tumor. This is the liver here. Liver is here. Lungs is here. And there's the heart of this 3-month-old Syrian hamster. Now this lump could have obstructed the passage of urine. So this may not be a bladder, an obstructed bladder due to cystitis, so that the hamster can't pass water well. The only clue is that there's a strong smell of smelly urine, and but it doesn't mean this is an obstructed bladder. It could still be a tumor, abdominal tumor, splenic tumor for this 3-month-old hamster. Although it's unlikely due to the young age of this hamster. Now these are probably the intestinal gas masses. Okay, now this X-ray is not very clear, so I have to put in the contrast. As you can see in the contrast, this is clearer. Now this is the heart, this is the lungs, this is the abdominal, this is the stomach filled with gas. Okay, now we are interested is only in this lump which the owner complained. This is the lump, which is quite big compared to the abdomen of this Syrian hamster. So I would say it's about 4 centimeter by 3 centimeter. It's not a circular fishball lump, it's more like egg-sized lump. Now what is this? So this is where from the smelly urine, which is a clear urine, so I cannot say exactly whether this is a mediastinal or splenic tumor, because as you can see, there are some parts where you can actually see the gas in the intestines. You see there's some parts you can see, because this may not be a solid tumor. It's a solid tumor, it is possible as well, but the thing is, it is egg-shaped size. So what it is now, I'm going to put under anesthesia to massage the abdomen and to see whether if it's distended bladder, of course, it will come out easily under anesthesia where the bladder is relaxed, the sphincter is relaxed. Then the other possibility, of course, is putting a needle in to draw out the distended bladder's urine, so that the hamster will feel comfortable and hopefully you'll be able to pass urine. This is a female. So now we have this history: anorexia, not eating, abdominal swelling, which is shown by the arrows, and the smelly urine for 7 to 14 days, which is what I asked the owner. Now the different diagnosis, of course, based on the smelly urine, it could be a distended infected bladder and causing cystitis and painful urination. So the hamster, of course, doesn't pee, and of course it doesn't eat because it's not well with a big swelling, big swollen bladder, or it could be splenic or abdominal tumor. So as to what it is, now I'm going to put the hamster under anesthesia, and there will be the other room. Okay, finish. October 26, 2016, just now I had given explanation of the physical examination and the history of this Syrian hamster, where the owner brought in with the complaint of lump in the abdominal area, a lump in the abdominal area. Now, as you can see, it looks like now you can see quite clearly. It seems to be pus coming out. This is a female hamster. Now it's very clear already, but earlier on it wasn't clear. So we had taken the X-ray, which I explained. It was a oval-shaped tumor, or could be a distended bladder. Of course, this is a female, so it could even be uterus. But now we saw a bit of pus in the urine. So I'm quite confident that this could be an infected bladder. Okay, so basically I put it back first. Basically I will anesthetize the Syrian hamster. After gas anesthesia, then I will clean up the abdominal area. Abdominal clean up, and it has been already clipboard. So after cleaning up, then I will palpate again, see whether it is really a bladder or is it other things, like for example stools or what. Then if it's really a distended bladder, and if I really can't massage it out, then I will use the needle to draw out the pus or the urine in this bladder. If it's a tumor, of course nothing will come out, because if it's an abdominal tumor, nothing will come out. But the danger is that if it's a hemangiosarcoma or splenic tumor, there may be a lot of bleeding. So I'm not going to do it yet, but I just prepare everything, and this is the urine container. Then after that, the hamster has already been clipboard. After that, then I will inject prednisolone plus Baytril with dextrosaline subcutaneously to provide fluid and antibiotics and painkillers to this hamster. So the best is not to rush into abdominal surgery or even cystocentesis unless we are very confident that it is an obstructed bladder. If it's just a distended bladder due to cystitis or pus or maybe sand inside the bladder, then it's best not to do cystocentesis, taking out the urine from the bladder for today. We will just wait till tomorrow and use medication, which is prednisolone plus Baytril, and see whether this will relax the sphincter muscles of the bladder. If the swelling is a distended bladder due to cystitis, then in that case we wait till tomorrow. Then this gives the hamster a better chance of survival. Okay, so now we start. So now I'm going to put the hamster in this container. Now the best is of course not to touch him because he's not happy. Now I notice his lower teeth are overgrown as well, due to not eating for probably 2 weeks. Now the best is to put it inside here, this container, which might be a bit too small for him. But let me just do it. Just do it here, because we don't need to be too big, otherwise it's hard to anesthetize him. Okay, this will be. Now I'll put the isoflurane gas in. Now this one will be about 5 minutes or less. Now 5 minutes or less, so we do the timing. And now there's no big surgery to be done, so I just have sufficient anesthesia. I'll just give 1 minute. So 1 minute 5% and flow rate of flow rate oxygen 4 liters per minute. Normally that should be okay. And then after that, of course, these are surgical records. We should write down the timing and anesthetic use. This is the anesthesia and surgery records. Then this is the physical records, which will be computerized now. Pay attention to this hamster. Okay, so it's about 1 minute or half a minute. I take it out to check whether he's awake. Now he's already sleepy, you can see. So from here we will have a manual expression. See whether we can express the bladder. From what I feel, there may be an obstruction of the bladder. Now I just clean up. Yeah, we see there's parts here of blood. Yeah, parts of blood. Now he's awake again. So the best is I will give some gas from this small tubing. But in the meantime, I'll put him in first. Now I'll put him in first so that he won't run away. Now this gas will be from here, the gas mask. So this is the other way whereby we can anesthetize the hamster to effect, so that he's sufficiently relaxed, and we can I can palpate properly whether the swelling is a swollen bladder or an abdominal tumor. An abdominal tumor, the swelling will be irregular. You can see it's quite down already, and you can see that there's really a swelling. Now I need to take off my gloves because it's easier to feel. Now I will feel the swelling to confirm that it's not, it is an abdominal swelling or is it a bladder. Now from what I feel, it's definitely a very big lump, most likely splenic tumor rather than a bladder. Now I'm trying to massage it out. The stomach, I can feel the gas in the stomach. Let's wait again, so I feel the gas again. And let's be careful, yeah, just beat only. Short time. So I just want to confirm whether it's a distended bladder, because distended bladder, when you massage like this, more urine will come out here. But it's unlikely to be a distended bladder. It feels more like a tumor, a nodular tumor with small nodules. Now you can see that urine has all come out already. So this tumor might have obstructed the flow of urine. So that's the reason that it can't come out now. You will see the teeth is overgrown. So I'll just give it a quick clip, quick clip while he's still sleeping. And basically I won't be doing any more things because definitely it's not the bladder. It's not a bladder, it's a tumour on the right side. On the right side. So it's most likely a splenic tumour, as you can see there. It's more to the right side than the left side. It's not there's nodules there. So it's likely to be a splenic tumour has suspected. Now, so we have finished our exploratory, and the next step should be surgery to open up and remove this tumour, but it's so risky, I will not advise it for the time being. So I'm going to give dextrosaline plus B2 subcutaneously, and that's it for today. So that's the purpose of anesthesia, is to find out in more detailed palpation whether it's a distended bladder or not. In this case, it is not a distended bladder, so there's no point doing abdominal centesis, cystocentesis, or even the correct urine. Okay, finish. That's it.
October 27, 2016. This is a Syrian hamster, female, 3 months old, with a complaint of lump inside the abdomen.
Okay, so this hamster had been having this lump, according to the owner, for the last 1 week or maybe more. Now the palpation of the lump shows that it's quite a large lump. It's quite a large lump. You see, in fact, it's quite a big one. I can even feel it here. Now, this is definitely a very big lump, and it's been X-rayed only lateral view. So lateral view suggests definitely not a liver tumor, but it's possibly a splenic tumor. But this hamster is only 3 months old. Now, so yesterday we put it under gas anesthesia, and I palpated and expressed the bladder so that the urine comes out. Now the interesting thing about this case is that the hamster has a very strong smell of urine, very strong. So at first I suspect it was cystitis, either that or the lump has pressed on the bladder, and so the bladder cannot discharge the urine. Now yesterday under anesthetic, the lump was much bigger. Now, as far as I can feel that this lump was more on the right hand side of the hamster abdomen, right hand side, and it was quite a firm mass. So the possibility, of course, it could be pregnant, because this is a female, but then the mate, there's another mate with her. The mate is a female, so there's no possibility of pregnancy. The other diagnosis, of course, is pyometra, because there was some yellow-white pus coming out here. So pyometra in a 3-month-old hamster is possible. Now I can feel the lump is not a smooth, rounded lump. There's a bit of irregular surface. So I did suspect it could be constipation, because this hamster drinks only one time, drink once a day and very little, according to the owner. Now, to substantiate what the owner said is true or not. So yesterday, after anesthesia and checking, I hospitalized the hamster, and as you can see, overnight, after clipping the nail, the teeth, overgrown teeth, after clipping the overgrown lower teeth, which was overgrown yesterday, I clip it, so it's shorter. You can see here, shorter. Apparently the hamster must have eaten, because overnight you can see the evidence
Now evidence of stools being passed out, which is a good news, because this shows that the hamster is not likely to be constipated, although he drinks later. Now, this one you can see the yellow. These are the urine stains. Now, from this we can tell overnight that the hamster does pass urine. Now, but I smell it. It is a very foul-smelling urine. So I was wondering whether this could be due to infection of the uterus and the bladder, because the pus, this could be the pus, and the pus comes out. Of course, it's smelly. It mixed with the urine, and this is likely to be either infected urine plus uterine discharge. So that is one possibility. Now, as you can see today, the hamster did eat. Otherwise, it wouldn't have passed stools, and it did drain because otherwise it wouldn't have passed urine. So now the thing is, the lump is still there. The abdominal lump is still there, and ultrasound might be helpful, but we will treat the hamster orally first with antibiotics and painkillers for the next 3 days, and give lots of water by syringe, to let her not be dehydrated. So for today, I will send it in for X-ray of the ventral dorsal, because what happened was yesterday, to save the owner money, we just did the lateral view, which was shown in the other video, but the lateral view shows a big swelling, and definitely you can see the swelling under the lateral view. But what is the swelling? Ultrasound may be able to tell. But I do a ventral dorsal view to see whether we can pinpoint the lump to be splenic tumour or not. Because if this can be done, then at least we know the diagnosis is splenic tumour. Although this is a 3-month-old female hamster, there is a possibility, of course, of pyometra. Pyometra is passed in the uterus. Although, of course, in dogs, 3 months is too young for dogs. Dogs are mature at 6 months, but in a Syrian hamster, they matured at around 3 months, because they can produce young ones by 3 months of age. So we have to know the reproduction of the hamster. So now this is a very good evidence of what's happened to the hamster, that the intestinal system, there's no diarrhea. So this shows that it's unlikely to be constipation, and the smelly yellowish urine stains could be vaginal discharge or due to pyometra cystitis. So basically, I will X-ray, and then my assistant will give water to the hamster to drink syringe by syringe. Let's say 0.1 ml every hour on the hour, and see whether you can flush out the toxic urine inside the bladder plus the uterus, and then antibiotics. So if that works, then of course the swelling, which could be a uterine swelling, will be much reduced, and with antibiotics for the next 3 days orally. So, but in the meantime, I need the X-ray ventral dorsal to finalize whether this is an abdominal tumor due to either intestine or mediastinal tumor in this 3-month-old hamster. We weigh already? We weigh already. So we also weigh every day. I put a 0 now. Every day we weigh so that we know whether it's losing weight or not. Should be 90. So it didn't lose weight. It's about that, not 91. And in fact, it looks quite active. So I have a feeling that that lump is an infected uterus. An infected uterus. But but we have to see from the X-ray. Okay, thanks. We're going for X-ray. Put it in the container. Then still pass a bit of stool and see. Pretty good news. He must be eating the intestine. Definitely not constipation, I would say. Oh, smallest. Which animal is the smallest?
This one.
No, I mean for your
So
setting.
far-
Setting.
This one,
This is the bird setting.
Wait, no.
Hmm?
How did you
Is there any hamster setting?
No,
Rabbit? No.
Try the bird.
Bird setting. Let's see, animal? Ventral dorsal.
Okay.
Ventral dorsal, not thorax, you know, abdomen.
Yak dog.
There, they put thorax there.
Thorax yan.
No abdomen. There is no abdomen.
Still okay, dog.
No abdomen, don't have.
Siya.
See got abdomen or not?
Got.
Abdomen, we try abdomen, see what the setting. Let's see whether it's pyo or not. Although it's not supposed to be pregnant, no males around. Abdomen setting, okay, can. So we see. Let's see whether I can check the lump in the abdomen. It's a very nice Syrian hamster, female 3 months. Female 3 months Syrian hamster. I noticed it has very strong smelly urine. And yesterday I saw some pus discharged from the vagina.
This one?
Yeah. And the urine is very smelly, so I suspect pyometra because of the fact that. Okay, right and left. Yeah, I need the right and left. A bit only. Don't block the. So this is right and left, the marker. Huh?
You want more in abdomen, right, Doc?
Abdomen only, yeah. But how to do the marker? So right is where? There is the right, huh? Smelly, right? Ventral dorsal only, yeah. As sharp as possible, huh? Okay, ready?
Dog, hi.
Okay, hi, ready. Dr. James are not in. Hey, where's the bag? I need the bag. I'm going tomorrow.
I'm still
Huh?
tracking.
Cannot. Never mind.
Oh my gosh, like this
No
one.
worse. This one worse than the day. Never mind, can see or not?
Last time, how you do?
No.
What is this? Feline or
But this is the
bird?
bird setting. Okay, right?
Oh, yeah.
Isn't it
Oh
like,
my gosh.
huh? Don't cancel it. Just leave it. Right? Let's see whether can. Got this part dominate, not the thing. No, that can. Let's see. But your setting is wrong, right? The setting is wrong. Too dark. It's underexposed. Is there the bird setting?
Yes, dog.
There on the right hand side, there I noticed the lump is on the right hand side. So is it spleen or not? Can it be much enlarged? No, a bit. Can it R? I know already. Okay, a bit. Yeah, let me see. Yeah, from the X-ray you can see that the lump is actually on the right hand side. So it's a circular one. So I don't know whether this is a infection of the uterus or not. And because of the passing of smelly urine, and the hamster is 3 months old. Other than that, the hamster looks better today.
Excuse me.
Okay. The lump is there, yeah. Circle like egg.
Is it biting the rat?
No, doesn't bite. It's a Syrian hamster, you know. 3 months old only.
Bit me yesterday,
Did
This is a second lateral view X-ray of this hamster. Now you can see the lump. You see a lot of gas in the stomach. Show the stomach. Where's your thing? The stomach. Come show the stomach. The gas in the stomach. Okay, this gas, and then the lump is below. It's a bit bigger than that now. Correct. That is the lump. Now the liver is there on the left. The liver. This is the liver, and so we suspect this lump to be a spleen tumor, but or it could be uterine. Any bladder here? Uterine pus. Intestine. Yeah. There's no constipation, right? It doesn't look like constipation. Okay, so where's the ventral dorsal view? Can we get it now? We can't, right?
I need to close this one.
Then get the ventral dorsal view and compare. This is actually done today, 27 October. This one is the old one. This is yesterday one. Yesterday X-ray. This yesterday X-ray. So now we look at today's X-ray. Yesterday's one. MI, but the lump is more obvious yesterday. You can see the lump here. I see. It looks like an egg shape. Egg shape, and then the liver is there. So we no, these three, then two. So today didn't have because
We did the
it's lost.
VD, why is it?
Yeah, the VD. Yeah. Because it's not here. Here, the VD. So look at the VD, enlarge it. Now, as you can see, the lump actually is on the right-hand side of the abdomen. It's still egg-shaped. Egg-shaped, yeah. So to me, no, it's bigger than that. It's bigger than that. To me, I was thinking maybe this could be pyometra or splenic tumor. Because what happened is this hamster is 3 months old and it should be sexually matured already. So X-ray evidence confirms a lump, a firm, soft lump on the right-hand side of the abdomen. But what is it? Is it the spleen or not the spleen tumor? I mean, splenic tumor or splenic swelling. But the only thing is the smelly urine. That is what I'm most concerned that this could be pyometra. I did see some pus coming out from the vagina yesterday. Thick yellowish white pus, a bit. So this could be closed pyometra. If closed pyometra in dogs, surgery, and hamster will be okay. If it's a splenic tumor, surgery will still be okay to remove it. So now we are at this stage where I suspect it is pyometra closed, or one uterine horn, or both. Because this is a 3-month-old hamster, so it's not like dogs where you can see clearly.